about concussions and head injuries. Dr. Scott, can you talk a little bit about what exactly a concussion is and how does it happen?
Yeah, definitely. But I think what we'll do is let's just start with statistics a little bit first, because everybody is afraid of concussions in cheerleading. And when you take a look, cheerleading tends to rank in the top 10 sports for concussions, but it's down near the bottom. So it's not as high as some of the other sports. So we do need to be concerned, but I don't think we need to be alarmed. What a concussion is, basically, if you take a look at the consensus statement that came out of Berlin a few years ago, they define a concussion as something where the head needs to accelerate and decelerate quickly. So you don't even have to get hit in the head. You can just come along, and if I pushed you from behind and the head moved fast enough that the brain jiggled within the skull and disrupted the nerves, then that could technically be a concussion. So I think it's important that we all understand you don't have to get hit in the head. And the other thing that's really important, a concussion is not a bruised brain. So we're always going to hear something called coup contre coup, where they talk about the brain moving in the skull, hitting the skull, and then bouncing off and hitting the back of the skull, and they define it as a bruise. It's not a bruise. If it was, we would see it on imaging. The other component of a concussion has to do with that you're really just stretching the nerves. So if you think of the brain as jello and it's shaking inside the skull, these nerves are being stretched. And I'm not going to go into the science of all of that. You just need to be aware that when you start stretching and shearing these nerves, they start to fire. But you didn't ask them to fire, so we call that an electrical storm. And that's the first part of a concussion. The second part is going to be once these nerves start firing and other nerves start firing around them, there's billions of nerves in the brain, then you start to lower fuel levels in the brain. And then one other component is going to be blood flow tends to lower in the brain as well. So when we look at a concussion, the head needs to accelerate and decelerate quickly, and you have to have symptoms. And these symptoms can show up right away or within the first 48 hours.
So, Dr. Scott, say someone's in a practice and someone gets hit in the head, or they fell to the floor, something happened, and the coach is worried about that person getting a concussion. What are some of the symptoms and signs that a coach can recognize?
I think the first thing, and this might be not what a lot of people want to hear, I think the first thing we need to understand is that sometimes symptoms aren't going to show up right away. So that's the first thing we need to be aware, and we need to really care about the athletes. That do we feel that head moved fast enough, or that trauma was large enough to cause the risk that there might be a concussion. So I think I just want to get that out of the way first, because we're always going in and doing these little tests, but there have been many cases where the symptoms don't show up till later and we let the athletes go back. We'll talk about that in a little bit, because it's not that I don't care about the concussion. I just care that we make the diagnosis proper, because if you send the athlete back and they were to get a concussion but they still had one, those are where the big concerns lie. So coming back to your question, the symptoms are basically going to be, and maybe we can post the 22 symptoms, but it can be any symptom that you didn't have when you started. So we generally go over 22 symptoms, but it can be anything even not on that list. So you're looking at some of the most common are going to be headaches, neck pain, nausea. They're going to be disoriented. They're going to be sensitive to light, sensitive to noise. Those are like probably the main ones. Maybe they lose focus or concentration. Maybe the eyes look glossed over. You can do what we call BESS, which is standing on one leg and testing their balance. But once again, we'll come back to these kinds of things, because if you don't know what they were like beforehand, you actually can't use that information. But it can be a good one. There's also another test called the King Devic. But once again, it's reading numbers on a screen as fast as you can. You can also use that as a sideline test, and it seems to be somewhat accurate, but you need their baseline. So the bottom line is going to be you need to use common sense. What did that head move fast enough? Try not to pay too much sense or attention to the fact that if they don't have symptoms, it doesn't mean they're okay.
So we know there's a lot of myths surrounding concussions. One in particular that I had through my experience doing level 7, a lot of girls would wear those helmets on their head when they were learning a new basket, or they were nervous, they felt a little bit safer, so they put those concussion helmets on. Can you talk to those and what you think about those helmets?
Yeah, I think we'll kind of tread a little bit lightly here. It's fine to wear the helmets. It's just understanding why we're wearing the helmets. So we wear helmets in football, in hockey. Like we can see we're trying to protect the athletes, but we're trying to protect the athletes from skull fractures and bruises to the skull. If you're wearing mouth guards, same thing. You're trying to protect the teeth. So what are the real reasons you're wearing this? Because what I get nervous about is if you're wearing these helmets and you think it's going to stop you from getting a concussion, you might become a little bit more reckless, right? That tends to be the case. But helmets, so we already described what a concussion is, that the head needs to accelerate and decelerate. A helmet has nothing to do with the brain moving inside the skull. So helmets cannot avoid concussions.
Right.
Neither can mouthpieces. So I every time I drive on the road, sometimes I'll hear a dentist come on the radio talking about, here, wear these mouth guards because they're going to reduce concussions. There is no research out there to back up any of these things. Because once again, if you understand what causes it or what the definition of a concussion is, you're going to know that, well, obviously it makes sense that these things aren't going to be able to avoid concussions. However, and we talked about this a little bit before, there are other things that can cause symptoms that appear to be concussions. So if you got a little knock on the head, but the head didn't move, but you hit a blood vessel or a nerve, you might get a headache. And then everybody gets concerned that you might have a concussion. Wearing the helmet might avoid some of these more muddy diagnoses, right? Because as we said, and I'm going to say it over and over, the head needs to accelerate or decelerate fairly quickly. So to summarize, helmets aren't going to reduce concussions. So if you're wearing them because you just had one, it's not going to avoid another one. And you better make sure you're fully recovered. Don't rely on the helmet to protect you.
So another myth I want to talk about is how we test for concussions. I know we see a lot of the time on TV shows, they do it different ways and then they make a diagnosis right then and there. What can you say about diagnosing a concussion?
I think let's come back to what I said before. Really, there's just the definition of what has to occur with the head. So the head needs to accelerate, decelerate, and there needs to be symptoms that occur in the first few days, like immediately up to the next several days. So when you see practitioners like myself or trainers on the sideline and we are going through a battery of tests, we're just trying to help ourselves determine, do we think there's something more serious going on? Because really, a concussion isn't really that serious. You just need to know that a person has one and that you keep them away from their sport until they're fully recovered. When we do tests on the sideline, we're testing for, do we need to send this person to the emergency room because there's something more serious going on, like a skull fracture or maybe some type of brain bleed. So when we're going through and doing things where you have to watch my finger, that's kind of what we're testing for. We're looking for things that are more serious, that we shouldn't just be leaving you here. You need to go somewhere else. So try not to get too hung up on that testing, because really, once again, a concussion isn't really going to show up on these tests. We're just looking for more serious things.
Okay. So the last myth I want to talk about is baseline testing, and there's a big debate going on right now about whether or not it actually works. So can you talk to that point a little bit?
Yeah, I really don't think there should be a debate going on. This is not something that I think people should avoid just because there's scientists fighting amongst themselves or people who read an article. The reason we're having this debate, there's neurological online computer tests that people do, and they call it baseline testing for concussions. Using that, when you look at the research, it's not very valid, nor is it very reliable, and especially the younger you are, these tests are not very reliable if you're only comparing it to normative data. So which means if we were the same age, I would compare my results to your results. Oh, we're not the same. in theory,
yes,
I'm much younger. So those are the types of things that everybody's fighting over, is these online computer tests.
Okay.
Now, that does become more accurate if you've done the online computer test as a baseline, because it becomes more you. You're not comparing yourself to a large population.
Right.
Where people are not understanding, let's just go back a step. If you go to the doctor and they're concerned that you have something serious, do they just do one test on you? No, they start doing a multiple of tests. So when we do baseline testing, we try to employ a lot of tests, not just the online computer tests. So you may do reaction time, you might do King Devic, which is reading numbers on a screen, you're going to do your balance. In my facility, we brought in a virtual reality eye tracking system to do a bunch of tests there. So we're collecting all of this data to help make better decisions as to when that athlete is allowed to return to their sport. So it's not used to diagnose, because we've already talked to the ad nauseum. It's just used to help clear the athletes at the very end after they've gone through everything. So basically, baseline testing is very useful, and a lot of the large sporting bodies are starting to admit, if you're in a high-risk sport, that you need to do the baseline testing. I think it should be everybody, because I don't see whether you're an athlete or not an athlete, you're a high-risk athlete. I've had enough kids that are on the level 1 and level 2 teams that are in the playground and they fall and they hit their head, but I have no data on that. So I think it's just more understanding the research as to what the fight is over. Even if it's an online computer test and that's all you're doing, it's not going to be very valid or reliable. They even say that, I'm not going to name the companies, but they'll even say on their website not to use this as a standalone test. So the more tests you have, the better information it is for the practitioner that's working with you to make the best decision for when you should return safely.
So when exactly should someone return safely?
Okay. So right now, a lot of the onus seems to go when your symptoms are gone, you're free to go. Symptoms don't correlate with recovery. That's why we talked about in the other segment about if we have all these tests, there are other parts of the brain that can still not be functioning properly, and you don't have to have symptoms when they're not functioning properly. So to return an athlete, and they kind of change this a little bit, there's stages. So let's not worry about how many stages there are, because it's constantly being changed based on the latest research. What we want to do is you have to make sure that the athlete can get back to school and be able to do everything without symptoms. So that's definitely an important part. At the same time, or later on, you want to make sure you're starting to challenge the athlete. So we may do something like the Buffalo treadmill test, a stress test, and we're slowly bringing up their heart rate to see if they get symptoms. If they don't get symptoms there, that's fine. We can move on to the next stage. We're still not returning them to their full sporting activity, but at least they can start getting back around the team and do things that are not risky, where they might get hit again, because they still haven't fully recovered, as we know, because they've only passed that one test. If they didn't pass it, they actually have to work and exercise based on whenever their symptoms started on that treadmill, we try to work at a speed just below that. And they need to do that for several days and come back and do the treadmill test. So let's just carry on. Let's say they pass the treadmill test. Then they're allowed to go to a couple practices, one practice being a little bit harder than the next. But remember what I said, you're still, like, you can't be stunting, you can't be tumbling. That's not what you're doing during these things. You might be working on the dance, you might be running around the gym. You're just in a noisy environment trying to get your heart rate up. Once you can spend a couple practices like that and we're still not increasing your symptoms, that's when we move to the return to play test. The return to play test is basically trying to simulate sport. And so all we're doing is we're putting you through something that raises blood pressure, lowers blood pressure, makes your head move up and down, makes your head move left. We're just trying to throw everything at you at that point to see if there are any symptoms. If you don't get symptoms with that you're not cleared at that point. We still try to do further testing. So this is where if you had a baseline when you were healthy, we would do the baseline at that point. So it doesn't seem fair because you're tired, but we try to make this really difficult to pass. So we make you do the baseline test again when you're tired. If you can actually equal the scores or better your scores, then we're pretty happy that you're probably fully recovered. Now, mind you, this is happening over like a week to 4 weeks. All of this is occurring. So if you pass that testing, you pass the baseline testing, then at that point, the conversation becomes, we feel that you're probably ready to go back, but we can't guarantee it 100%. We just know now that the longer you take to go back to sport where you might get another concussion. So the longer time in between concussions, the less likely you're going to see long-term effects. So that's where in the past we would have just got up right away and carried on. Now we're spending weeks. And so You have to pass all that. We make it take a lot of time. Everybody needs to go through this process if you're an athlete. You can't just say, my symptoms are gone, I feel great. The practitioner needs to try to elicit symptoms, and they need to have something to compare. What were you like when you were normal? And that's basically the whole gambit. Generally in cheerleading, it becomes a little tougher. In most sports, we say you need to go back to a practice before you go to a game once we clear you. In cheerleading, the practices are where most of the concussions occur. So I'll have a discussion with the coach and the parent that maybe let's just work the athlete back in with safer skills, see how they do, and then we go back.
And can you talk about how the neck is affected when we get a concussion?
So at the very beginning, we talked about that the head needs to accelerate and decelerate. It's like something has to happen where the head moves. The amount of G-force that's required to cause a concussion is pretty significant. For the neck, it's actually quite small. So you can imagine that if we think you have a concussion, you're going to have a neck injury. And why are we talking about this right now? We're talking about this because whiplash or neck injuries have the same signs and symptoms as a concussion.
Okay.
And that makes my job really hard because there's a lot of pressure to try and get these kids back. Do they have a concussion? Don't they have a concussion? So be aware that the neck has the same symptoms, and you're gonna have a neck problem if you have a concussion. But you can have a neck problem without a concussion that appears to give you concussion-like symptoms. So when we go through, we assess and we try to do a bunch of stuff to the neck to see if we can exactly reproduce the symptoms. We try to get some video to see how fast the head moved, what was the actual event that occurred, before we rule out that it's a concussion and it's only a whiplash. So most of the times we can't do it. We just say, you have a concussion and a whiplash. It may just be a whiplash, but we're gonna err on the side of caution.
Right.
So I think it gets difficult. We just need to be aware that whiplash and concussions tend to go hand in hand.
And last question, what is the major concern with returning an athlete back to practice too soon?
So like we talked about this a little bit, and we said that I'm not that concerned about a concussion because really you can fully recover if you get managing this quickly. What we're concerned about is if you have a concussion and there's been a mistake, or we're ignoring it because, when I used to do this, we didn't worry about this stuff. If you allow the athlete to go back and they still have a concussion and they were to get another concussion, now I care a lot because it can take a lot longer to recover, or it can be the effects can be very long term. So that's probably the biggest reason, is that these things can become quite serious if an athlete gets a concussion while they have one. And some of the research is showing that it takes less force to cause a concussion when you have one. So that even makes it more problematic.
Right.
But what we are definitely seeing is long-term effects. Some of them can be quite severe if you get a concussion while you're still recovering from the other one. So I'm really adamant that if you have ankle problems, knee problems, fine. You guys can try and work through some of these things, tape yourself up. But when it comes to the brain, I wouldn't be messing around with this.
You
only got one. You want to make sure you're fully recovered.
Yeah.
Okay.